Okay, we're almost done with our bone exam. We've gone through the axial skeleton, starting at our cranium, moving through the vertebrae, our ribs, through our chest cavity region, the sternum. We've also started into the appendicular skeleton, focusing on the arm region, including our pectoral girdle and the bones that make up the arm and hand. Now we're going to move into the leg region, still in the appendicular skeleton. So starting at the top, we have our os coxa. So that is your hip bone. So your hip bone is actually a fused bone made of 3 different bones. The 3 bones that make up your os coxa. So one way to remember that your os coxa is the hip bone, one student gave me this idea that you shake your os coxa, kind of like shaking your you-know-what. So with your os coxa is made of 3 different bones. You will have to be able to label them on the exam. So here's our os coxa, a lot bigger version. Up here, this big elephant ear section is your ilium. Back here is your ischium. And this front section is your pubis. So this hole here is actually split into 3. So you have your ischium section, your pubis section, and your ilium section. Other features on your os coxa is your acetabulum. So that's your hip socket bone here, where your femur will articulate or make a joint with your hips there. That's actually backwards. Oops. Let's try this again. It's actually on this side. Okay, so femur makes your articulation or joint at that acetabulum. So that's this circular portion here. Other features to know for your os coxa, your pubic symphysis. So there's a joint where your 2 hips join together in the front. So that's this portion here, right here in the middle. Also need to know the iliac crest, which is on top of your ilium. So that's this rough surface area at the top here. And your ischial tuberosity, so another rough surface off the ischium bone that's here. So ischial tuberosity here. So we have ilium, ischium, pubis, iliac crest, ischial tuberosity. Whole thing is os coxa. So here's where your vertebrae ends. So some more lumbar vertebrae, sacrum, coccyx, all that stuck together as one, basically. Okay, so the next bone is the femur, again making a articulation or joint with your hip bone at the acetabulum. So your hip bone is one of the largest bones in your body. Very long bone, hint hint. Okay, so femur is a long bone. You will have to be able to know left or right from that one as well. So the little big ball, oh wow, can't see that. The big ball at the top, that's the head of your femur. It's going to go into your hip socket. Oh, I don't want that. So here we have this femur matching similar to the smaller femur on the little whole skeleton or our articulated skeleton. So your ball is going to go into the socket towards the medial or midline of your body. And then to tell which side is the front or back, at the bottom of your femur where you're making your knee joint, you have another big divot in your bone, also going to face on the back side. So here's our back one, going to the bottom of this. This is going into our hip, so therefore this would be on our left side, so a left leg femur. Okay, so again, head, ball portion that goes into the socket. Inside that ball portion or the head of the femur is the fovea capitis. So this little divot in the head is where a tendon connects. Other features to know, so you have your greater and lesser trochanter, which are unique to your femur. So here we have one trochanter, that's your greater one, so the larger one, again, being more superior as well. And your lesser trochanter, which is smaller and also inferior with your greater trochanter. At the bottom of your femur, you have your medial and lateral condyles, as well as your medial and lateral epicondyles. So again, knowing your left from right is important to know which one is which. So let's go back to our left from right. Again, this is a left bone, so here's our big divot in the back. The head of the femur going towards the middle portion of the body. So here at the bottom, condyles are the features that are going to make an actual joint connection with another bone. So those are at the bottom. So if this is on the left side, this is the medial condyle. This is your lateral condyle. The epicondyles are above them. So these little knobs off on the side. So medial side, so medial epicondyle, medial condyle, lateral epicondyle. And that is it for the femur. Okay, so below your femur are your tibia and fibula. So the tibia is the larger bone in that pairing. So let's show it on a little smaller skeleton here. Put his leg up. So we have the tibia being the bigger one here, the fibula being the smaller one on the outside. So if you remember your fibula, thinking like it's the smaller bone, kind of like, little kids tell fibs or lies, because they don't know any better really. So the little ones on the outside also works kind of like a cane on the outside. So remembering that it's going to be on your lateral side for the lower leg. Going back to your tibia. So the features that you have to know on the tibia are your tibial tuberosity. Again, knowing the left and right on this bone as well. So this very pointy, ridgy portion of your tibia, so of course when you handle these in the lab, it's going to point to your front. That's actually the portion that you can feel on your shin. So with your left versus right, the easiest way to do this is remembering that your tibia is going to be more medial on your lower leg. So this bottom portion called the medial malleolus hangs over your ankle. So I'm going to pull a foot up. So those help to stabilize your ankle. So it's going to hang over that one. So if it's on the inside and has to be able to hang over the ankle, then this is, again, another left bone, so on the left tibia. So this left tibia, able to tell that this is the medial malleolus, again, being able to tell left versus right for your exam. The tibial tuberosity is this little knob here that has a little bit of rough surface. Of course, let me smooth the tape. Okay, so, of course, it's a plastic model, can't really tell too well, but there are some real bones in the lab if you want to touch those as well. So, tibial tuberosity is this little knob here. And that's it for the tibia that you have to know. For the fibula, it's not as easy to know which side is which. You don't have to know left from right, but you do have to know the head and the lateral malleolus. Again, your fibula is the smaller bone, only used for supporting the ankle, doesn't bear any weight in the body. So for your fibula, they kind of look very similar. So here's the head region, which is kind of more club-shaped, and that's one of the features you will have to know. For the lateral malleolus, it's kind of more arrowhead shaped, so a little bit more pointy. Again, its job is going to hang over the ankle and help to give support. So just kind of gives a little more stability to that ankle region. And that is all you need to know for the fibula. Oops, I skipped this one. Oh well. So going back to our knee region where our femur makes the articulation or joint with the tibia is your patella. So your patella is commonly known as your kneecap bone. So right here, of course, you're showing it where it's like fused to this one, plastic model. Hey, what you gonna ask for? Okay, so this bone actually slides across the front of your femur. What's special about this bone is it's a sesamoid bone. So sesamoid bones are embedded into tendons, And your kneecap is a very large one. Okay, you're not focusing. Oh well. There you go. So here's our patella. It's kind of triangle shaped, so pointy here at the bottom. It's going to slide on that surface right across the front of that femur. So there's your back. Here's the front side, sliding across that front side of that femur. Your patella, tarsals and metatarsals. So down to the feet. We're almost done. Okay, so with your tarsals, again, these are tarsal toes, knowing which ones is the ones that go for your foot. The carpal's going for your hands, so think carpal tunnel syndrome because your hands are getting overworked from working the keyboard. So back to our tarsals, there are two tarsals you need to know. You need to know the calcaneus, which is your big heel bone at the back, as well as knowing your navicular bone for the navicular tarsal bone. Your navicular is more rectangular shaped bone. Don't have to know between the talus or the cuneiform bones. But here's your talus, here's your cuneiform. So it's this one right here. Your talus is the one that's actually going to make your ankle joint and is at in a sense, your top of your foot. So we're just looking at the bone that's right in front of it. So there's your navicular. Calcaneus is your big heel bone. Believe you have to know left or right for your foot. Of course, that should be kind of obvious as big toe. That's going to be in the center. So that's your center and then going out towards your pinky toe. For left or right for your foot. So of course, big toes on the middle. Or another way, a student taught me, her husband's a podiatrist. If you hold the foot as if it were a gun, then it should fit comfortably in that hand. So here in the left foot, fitting comfortably in my left hand. Here on the right side, it's actually a little awkward because you have this extra bump on your actually it's on it's on this one. On your calcaneus bone that's actually pushing into my finger. So here fits nice and comfortably for the left side. Okay, so same thing with your metatarsals and your phalanges, like your numbering system as well as your distance systems for naming the bones, starting in the middle with your big toe. You have number 1 for all of these bones, so these are your tarsals, so let's ignore those. So above that, or more distal to that, you have number 1, 2, 3, 4, 5 for your numbering system. So metatarsal 1, metatarsal 4 here. For your phalanges, still keeping up your numbering system, 1, 2, 3, 4, 5. You have your only 2 in your big toe, so that's your proximal and distal. So proximal number 1, proximal phalange number 1, distal phalange number 1. And let's do this one. So we have proximal, medial, and distal. So proximal phalange number 3, middle phalange number 3, and distal phalange number 3 at the tip. So that is it for the bone exam. Yes, it's going to take time. Yes, it's going to take time to handle the bones. Again, the labs are open when the buildings are open. So the lab should be open even until 9 o'clock when the building technically closes. Sometimes they don't exactly kick you out because I've had students who accidentally were just still here because the cleaning staff is still here. So, yeah, they just kind of work around you. But again, the bones, when we do start studying for them, they will be out for you to study. So take the time to handle them, because on the test, you will have to be able to take a bone and pick it up and realize, okay, left and right, what is this feature, by handling the physical bone. There are apps as well as the flashcards and looking at Connect with the dissecting tool, able to look at the bones in a 2D, something where at least you can carry it with you, since you cannot carry your bones, the class set of bones with you, but you still can have your pictures to study with. Again, a lot of your cheap Halloween decorations. Of course, this isn't one of the cheap ones, but cheap Halloween decorations. Take a Sharpie, you know, if there's missing some features or you want to point out something specific, take a Sharpie to it and draw all over it. Hey, it's cheap. Why not use it? Your point is to pass the test. I think that's pretty much it for the bone exam. So yeah, just gonna take your time with it. Don't rush through it. For the spelling, there will be a few word banks out. Please use them. I've had so many people who've missed quite a few points because they were too lazy to double check their spelling on the word bank. So I think I'm going to leave you there, and happy studying.